I'm excited that this is your first. You have a lovely home, by the way. It feels very zen from here.
Oh, thank you. Yeah, this is my office that I actually had a backyard office built about 4 months ago. And so it just has changed my world. So yeah,
Where
it's
did
really
you get
cool.
that idea?
We have a smaller home. Once our daughter left and went away to college, we downsized. We have a smaller home. We both work from home. And I, like many people during the pandemic, was moving my desk into my bedroom and working out of that space. And yeah. And so just was like, you know what? I need a space. And got together with this person who'd been working on our house and drew these plans. And this all kind of came to fruition. And so it's just been a game changer for me.
So is it separate from the house?
Completely, 100% separate. So I literally walk out my back door, go to work in a separate place all by myself, outside, separate from our house, and then, go home for lunch.
I mean, that's, in my mind, that's revolutionary. Like I'm gonna stock that for later in the future when I have a house. But I don't know, maybe someone's already done it, but that's brilliant. Like you're still at home, but you're not stuck in your bedroom. During the pandemic, that was the worst.
Oh, yeah. We all
I
know.
wanted to turn around and nap every time. I would just look at my bed like,
I know.
But I could go take a 5-minute nap. And living in apartments, and sharing apartments, it's not like I could just like pitch tent in the living room. So
yeah.
Anyways,
I know. Yeah.
So
I love it.
First, introduce yourself. Your name, your social security. I'm just kidding. None of that. But let everyone know your name and kind of, I guess, how you were introduced to NOS, and also a little bit about your work, past work, professional, but also, any personal stuff you'd like to share that kind of like ties you into what we're talking about today, which I would like to be the icebreaker and share with everyone now that it is psychedelic treatment therapy. And I'm so pumped, so excited for this. This is, I don't want to say Wild West territory, but arguably it might be. But after our conversation, I'm pumped to unpack this with you again.
Well, thank you so much for having me. I'm really excited to be talking about this topic as well. I am Dr. Michelle Shuler. I am an LPC, an LCDC, and for those of you who aren't familiar with that one, it's Licensed Chemical Dependency Counselor. I am the Department Chair of Human Services at Austin Community College, and we have a General Human Services track and the Addiction Counseling track. So I've been a counselor educator for probably 15 or so years, training clinicians at the master's level and at the undergrad level. Started working at Austin Community College in 2018 and just really fell in love with our human services students, just completely overwhelmed with joy to be with them. They're so incredible people. And so started doing this work in 2018 and have been kind of doing it ever since. I keep a small private practice where I typically see folks who are either seeking recovery because they've been struggling with an addiction, or in recovery and hoping to maintain that lifestyle. So I've been seeing clients in the Austin area since just a little bit before pre-pandemic. And in terms of getting involved in this work that I'm doing now, which is around psychedelics and psychedelic-assisted therapy, I really got interested in this around 2018 or 2015 because my clients were coming to me who had been suffering with mental health conditions and all of the things that go with that, and struggling because the treatment they've been receiving hadn't necessarily been helping or working. Many of them had been, given multiple types of prescriptions with pharmaceuticals to try and help overcome all the things that they were going through. And long story short, many of them were coming to me asking me what I knew about the psychedelics and mental health. And I was like, at the time, I was like, well, not much. I don't know. In fact, I don't know anything, you know? And so my clients had quite a bit of knowledge because they had been surfing the internet. They had been getting in touch with people who were kind of doing psychedelic therapy, kind of underground, I guess is the best way to describe that. And they were really wanting to know if I knew if that was going to be beneficial, helpful, how could they access it? And I honestly knew nothing. But that's how I began to be curious about it and started seeking out more information around it. It's been a couple of years since those first introductions from my clients around psychedelics. But in that time, as I began to gather information for myself, look at the research, read the research, talk with other people, you know, I began to become far more aware of the potential for psychedelic-assisted treatment or therapy. And so embarked on a journey last year to start becoming a certified psychedelic-assisted therapist. And so currently I am enrolled in the Integrative Psychiatric Institute out of Boulder, Colorado. I'm a student in their certification training program, about halfway through, and just overwhelmed with information and gained access to incredible practitioners and people and the institutes that are doing the research, and just really kind of like immersed myself in this area. And so here I am today, you know, talking with you about things that I've learned, you know, the community that I've been and getting connected with, and just my own curiosity about what this is going to look like, you know, what this will look like for our profession, for behavioral health, for people who are seeking out psychedelic-assisted therapy. So here I am today talking with you about it, and it's pretty amazing.
It's a very natural evolution. I can see that, and I love that it was sparked out of a need, and that you had clients that were comfortable enough to come and ask, you know, can you help me find out more about this? Two things I'm curious about. The first one is, as your patients came and asked you questions, you know, about psychedelic treatments, did you, and you said you didn't know much at that time, right? Did you find you had people around you, either coworkers or other professionals, that you're able to turn to and comfortably say, hey, do you know anything about this? Or was it, did you have to seek out pretty far the answers,
Mm-hmm.
you know, once your client started asking these questions?
Yeah, that's a great question. And honestly, first of all, I didn't know who to turn to. And so that was a bit of a confusion for me. As practitioners, you know, we keep a lot of people around us, colleagues, other professional supervisors, all of our go-to folks, when we have clinical issues and concerns and questions and things we want to talk about. But in this instance, I honestly had nobody in my book. I was like, I don't know who to turn to. And so, but fortunately, because of the area I live in Austin, Texas, and we tend to have a lot more progressive treatments going on here, just in general. And so I was able to connect with some people kind of outside of the typical mental health profession. So there are folks in this area that are practicing alternative treatments. And so I was able to reach out to a few folks that are practicing alternative or complementary treatments and begin to get information from them. But that was very far and few between. And so really it was my own path, my own journey of just kind of getting online, looking for information, seeking out resources. And so it wasn't something that kind of came too quickly. It took a couple of years for me to just kind of sift through some information. There's a lot of misinformation out there as well. So, I mean, it was a bit of that. So there wasn't a lot of people to turn to at that moment in time. And so I was kind of walking that path alone for a period of time before I got connected with a bigger community.
Yeah, it's a continuing education opportunity, but that's also because obviously the education has not been in our curriculum as far as the way in which you and I have come into the human service profession.
Right,
Academically, it's just not there. So you can definitely
right,
see you had to go out and look for it, just kind of self-taught. I'm just always wondering, like, are how big these networks we have in the field right now. How much chatter there is about this. If there is more often than not somebody that you either work with or know who is also interested in this, or has maybe more information, or that you just hear the conversation about psychedelic assisted therapy happening. So to me, it sounds like it not so much, but again, just like your clients did. You had to go out and find it, and you found a whole program, which is awesome. I want to double back to the misinformation part, but real quick, let's talk about exactly what psychedelic assisted
hmm
therapy is.
okay,
So our viewers can kind of understand, what kind of psychedelics specifically, that you're working with in your studies, but also is kind of like the focus right now, because they're not all just, it's not a free for all as far as
right.
therapy goes and research.
Yeah. Yeah. Okay. So, and I want to sort of make a disclaimer. I'm not actually practicing with these substances yet as a practitioner, mainly because I'm going through the certification path. And so that when that is complete, and I am certified, then I will be more likely to engage in the actual psychedelic assisted therapy, which I'll talk about here in just a second. And of course, not all of these are FDA approved. I'll try to mention what is in that process of becoming FDA approved. And not all states, obviously, are considering the legalization in general of these substances. So there's a lot going on there. But anyway, so we're talking, so psychedelic assisted therapy is the modality that's coming forward based on research that is providing the protocol for practitioners to engage in the use of psychedelics in therapy in a clinical setting. And so what it typically is looking like at this point is that there will be several stages in terms of the treatment model. There will be some preparatory sessions if we're talking about like a typical client practitioner relationship. There are preparatory sessions. There's a prep stage where the client is prepped in regards to what to expect, how this will look, what they might experience, what it will be like under the influence of the medicine. So typically those are like anywhere between 2 to 3 sessions, prep sessions. And then there is a dosing session where the client, under the supervision of a medical professional and what we call a sitter, someone who's sitting with them during the under the influence of the medicine. And that, depending on the substance, takes anywhere from an hour to an all-day experience under the influence of the medicine. And then there will be what we're calling integration. So multiple sessions post dosing where the information that the client receives under the influence is processed with a therapist, integrated into their life, and made meaning out of. And the typical integration sessions are anywhere, depending on the setting, anywhere between 1 to 3 or 4 integration sessions. But the emphasis that's coming forward in the research is the real need to have these 3 stages involved in a treatment. Let's call it an episode. And that is showing the most positive outcomes. And so that's what we're calling psychedelic assisted therapy.
It just popped in my head, and I'm this approach is, in one angle, it's quite obvious why there has to be a prep, set and setting situation, and then an integration. But I just realized it just dawned on me, like compared to prescription medications, whether there are SRIs or for chronic illness, that's never been the approach to pharmaceuticals. Short of like, take this for 2 weeks, let me know what the symptoms are, come back. Now, granted, it is not like you are, no, I would presume with most prescription drugs, approved by the FDA, you're not succumb to an episode in which you are, I guess, pulled out of your own modality, right? But again, it's like either we are looking, researchers and professionals that are like doing these studies, looking at what we have not done right so far, but obviously confronting the fact that like you can't leave. No. So I can see both, and I love that. I love that the requirement for that to be the case, for the modality to be set up in 3 stages, and that integration, of such a beautiful word, is not only like has to be in place or just shows the best promise, but it totally blows out of the water the way we've handled prescription medications in the past with mental health. So like double win there, right? Not only might this work well once or twice, but it works because it's a way better delivery system. That's awesome. So tell me a little bit more about, I know you're not working directly with, and you've laid out the way, like how a patient or a client would walk in and, go through this process. What are the psychedelics that are being focused on right now in like research, but also in, clinical trials and such?
Yeah. So the one that most of us here have heard about, or maybe most of us hear about most frequently, is ketamine, MDMA, psilocybin, and LSD. Those are the 4 main substances that are undergoing clinical trials. Ketamine is already an FDA-approved substance to treat, off-label treatment-resistant depression. And so there are quite a few clinics, providers that are using ketamine in their practices. MDMA and psilocybin are both in clinical trials, phase 3 clinical trials, and the information that's coming forward is that will show positive outcomes, and those will be FDA approved relatively soon. That is the language that the researchers are using and the information that I am receiving as a student. And so those 3 are right now the ones that we are hearing the most about, because ketamine's in use. MDMA and psilocybin are in stage 3 trials. And so those are the kind of main ones. LSD is undergoing clinical trials and has its unfortunate history to begin with. And so I can't speak very well to LSD, but the other 3 are pretty prominent.
Right. Yeah. It's phenomenal. It's like surreal to hear stage 3 trials, and that, it's wow, that's going to happen in my lifetime. And it's going to rock the world, right? Because that approval rating from the FDA is, there's going to be backlash, but I think there's probably going to be more backlash from the companies that are going to lose profit, right? That can't be dishing out medications like they do. And I'm not going to say all pharmaceutical companies are like that. But still, I think people tend to be more, the general population tends to be more on board and quote unquote centric, I dare say open-minded, than we kind of perceive it in our own, narratives. So yeah, that's, and so we had talked about before, actually, it's moving along in the academic world, and yet it is kind of nowhere to be seen in our conversations as far as the material that we receive in class. Now, I haven't had a human services, well, I do a lot of interdisciplinary stuff, so sometimes it pops up, sometimes it doesn't. But, HS 101 wasn't talked about. maybe mentioned a
No.
couple times, maybe during
Yeah.
like, the substance abuse course, but it it's like,
Yeah.
okay, it's like, are we all going to be hush hush about it until there's like a green light to go from the government? Or, where do you see from the
Yeah.
inside as a, a teacher and an educator, like what's happening?
Well, honestly, I can say not much as far as, what's going on other than at the research institutions and where the real research is going on. So
Right.
in terms of like trickle down and how much this information is getting incorporated into our curriculum in terms of how we're training human service or mental health professionals, in my knowledge right now, is nowhere. And I am super, super curious and super concerned and wondering myself how this is going to be integrated into our work. Because in my mind and my vision, and as I see these medicines coming on board, what is behavioral health in general? What are the human services fields going to do with it? How are we going to integrate it, incorporate it into our system?
Mm-hmm.
And that's a big unknown. There are individual practitioners who are doing their thing. There are private companies that are setting up their own clinics. But how will this get integrated into our system for everyone to be able to access this is a complete unknown. How will we be training people to become therapists, to understand how to even assess someone's appropriateness for psychedelics? I mean, it's the whole 9 yards. And so it's not there. We're a little behind. I'm going to say it. I'm just going to say, as a counselor educator, as an educator, I feel about 10 years behind what's happening with psychedelics in terms of treatment. So that's a big unknown. And that's why I'm so excited to talk with you today, because, my question is to everyone, what do we want to do? How do we want to incorporate this? How do we want to begin to talk about this? And what is our role? And so I'm super excited to kind of put that out there.
It's a beautiful question, and it's a strong, how do we redo this? How do we make sure that our culture doesn't shut it down, or, that the same mistakes were made that led up into the war on drugs, which really has just led us back here. If we're being honest, the problems that have come out of the war on drugs and also the opiate crisis, and now we're back, the consequences of that, the solution happens to be the thing that rushed us into the fake problem in the first place. Humans are weird. We're a bunch of weirdos. I'm wondering, I know that, who makes the curriculum? So, okay, let me back up a second, because I'm still curious about, like, yourself, the academic side of it, but also the training and mental health integration as well. In all sorts of disciplines, and I'm thinking strictly academia, when a new idea is brought forth, most people are like, nah, you're crazy, that's wrong, that's different. And then later someone comes along like, yeah, they are actually kind of right, this is probably a good idea. Apart from having, people leading the frontier in academia, and also behavioral health training and professional things alike, who makes our curriculum? Whose office am I writing a letter to saying, can you please add this to the textbook next year? Or is that also, is that a government thing too? Like, I feel like I should know this, because it was one of my biggest, I hated that I was learning stuff I didn't need to know in college. Someone else was giving me material and telling me that, hey, you paid to be here, but learn this. But like, where's the shiny altar in the sky, or the entryway, besides it being someone in academia coming forward and saying, like, I'm going to be a pioneer and I'm going to start teaching my own classes. That does happen. But where are there's got to be more than one access point, or we just kind of try to bottleneck in and really risk, doing it the wrong way.
Yeah, well, those are great questions, and that's a pretty layered answer. And my kind of go-to quicker answer probably is, instead of spending like an entire week with you talking about the frustration around that, is that in our professional training area or curriculums, a lot of it is determined by our licensures, like and our scope of practice. And so there's a body of individuals who kind of oversee determining the scope of practice, and then our curriculum gets built around those scopes of practice, and then those kind of get built into our state regulatory agents and regulatory bodies that govern and oversee those licensures. And so a lot of programs are designed around those kind of scopes of practice and those licensures that we obtain once we get through our education. And so there's a lot there. There's a lot to kind of try to understand around how those get developed. But let's just kind of say that there's a lot of commonality around programs. We're all kind of teaching the same thing. We're all kind of teaching the same areas. We're kind of putting our own sort of spin on it, of course, and trying to keep up with the newest information that's coming out of research institutions. And so we kind of are behind the curve on this one. We're not integrating this information into our systems. And I will also say that our state, and I'll speak for my state licensure board and licensed professional counselor board here in Texas, has nothing to say about psychedelics in terms of treatment. So they haven't made a stance or began to talk about how that might be incorporated into our scope of practice. So there's a long road ahead, for all of us.
Yeah,
So,
I'm going to play devil's advocate for a second, because it pops in my mind like the word "yet." I can see maybe from the size of those individuals and groups making these decisions when to start integrating this kind of information, to wait, not just for the seal of approval, but for just the right amount of research that comes out and says, we've got this. We got this. Like, we've got cognitive behavioral therapy. Like, this works. And then I can definitely see, the job openings in this field are going to go berserk, because as soon as that right moment hits, where like the confidence can be there without the worry of it being torn down again and taken away, an opportunity that, in a year's time, every public and private university and every, licensing board is like, here's a pamphlet, here's an opportunity, so I can see probably hesitation, but I also see maybe a little bit of potential for it to be like an explosion or into, so many different avenues of work. So, all right. I just had that kind of thought. So like, maybe that's the case. Oof, talk about a revolution. That would be a psychedelic revolution, and it would be in our field.
It could happen. That's why another reason I'm like so excited to have this conversation, because this could happen. This could happen, and I think it's also imperative to say that the responsibility around how this happens is there. I think that we need to be very careful. We need to be very thoughtful. We need to be very open to, understanding this from a whole new perspective. But yes, the opening could potentially be there. And again, creates a real sense of responsibility about how it gets rolled out.
Mm-hmm. Mm-hmm. I love that word, responsibility, especially I think it's super core to human services, which might be kind of a no-brainer to some people. But when it comes to the autonomy of others that we try to advocate and protect,
yes.
In due time, like that is not just, it's a responsibility, just like, not to get too philosophical, but freedom is also a responsibility. Like, you can't just have that and run with it. Like any tool can be used poorly or negative or positively. So going back to the modality of it, how what's the trickiness of getting these psychedelics in office for treatment? Once you have your licensing, right?
Mm-hmm.
Then where do you go? Because I'm sure it's kind of a weird avenue, and it's state by state. Like, okay, so you can now do this. You're a trained professional, once you finish your program. But then what?
Yeah.
Do you just start? Do you have to move? Like, how is that working out apart from private practice?
Yeah, no, great question for sure, and one that's a difficult one to answer. But my goal right now is to work my way into ketamine, providing ketamine services, and there are enough private clinics in my area now that is feasible. Like I could potentially, get a job as a practitioner at one of our ketamine clinics in town. We have enough that could potentially happen. You can also, because ketamine is a legal substance and FDA approved for off-label treatment. You can, as a practitioner, set yourself up a couple of ways. You could be the integrative therapist, where you're not actually present during the dosing, that someone is going to a clinic and receiving the medicine, and then you are meeting them days or 2 days later to do the integration. So there are a couple of ways for you to step into this space right now with ketamine. You could be connected with a provider, a medical professional who provides ketamine. And that person provides the dosing, and then that provider refers you to, or refers their client to you for integration. In terms of the other substances, the MDMA and the psilocybin, I'm going to try and be cautious that is happening in a more underground arena, and how practitioners are actually doing that is unknown to me, but it is occurring. And yes, there are just only a couple of states, Colorado and Oregon, I'm going to say, I might be missing one or two, that have decriminalized psilocybin. And that is a different ballgame there. So, you could move to Oregon, you could move to Colorado and be practicing legally. And that's kind of where it's at right now. So I would imagine, my imagination says that once the FDA provides approval for MDMA and psilocybin, things will shift. Things will most likely change in terms of being able to access those medicines, probably state by state. And then there's also licensure by licensure. What professional licensures will actually accept that in their scope of practice? That could become a whole new territory that, we're not sure of. So
I'm humored by the idea that, it all comes down to the drop of a hat from the FDA. And my mind seeing people coming out of their underground bunkers, like, here I am. I have medicine for everyone, but it's the same issue people have had since the weird sticky walkthrough of medical marijuana, right? Like here in the state of Georgia, you can have a card that says you can, you're allowed to have it, and it's like a few different diagnoses that you're permitted to have it, but it's still against the law for you to get it. So people have to go around that some way, right? And it's federally illegal as well. So I would not like to see that happen with psychedelics, because they're already too substantial of a, not toxin, but they're so mind altering. We all know this, that it would be so irresponsible of the government to say, okay, yes, we believe your research. Yes, we're going to give you this much wiggle room, but you got to figure out the rest on your own. And by the way, still don't get in trouble in that spot or this one. Like we, with at least in human services, and like you said, like these other kind of licensures and professions that we share a space with, we all have to show up together and make sure there's a unified beginning, and strong foothold in every step we take, or else, there's just that, again, that risk of being pushed back. But then again, maybe not. I definitely see so much, I will say, professionalism and real careful curiosity in handling the psychedelic research. Let's jump real quick to it's the treatments and the type of diagnosis. A lot of research done on substance abuse, MDMA for PTSD. So can you kind of give a brief, like, how do we get to these psychedelics and start with these types of a diagnosis, right? And I ask also, being as a normal person who my mom has chronic pain. She has a nerve disorder, but there's very, very, very little research being done on psychedelics and her type of nerve disorder. And I'm wondering, like, okay, did someone out there like find it out one day? They're like, hey, y'all, it works for this. Let's go this way. Or I don't know, just natural curiosity.
Well, I'll do my best to answer that question. There's just a wealth of information around that. But and of course it goes back to the 50s, with the discovery of LSD. And at that time and I'll hopefully get my history somewhat accurate, but at that time there was a wealth of research happening around LSD and mental health disorders, and a lot of positive outcomes coming forward. And then we all know kind of what happened with LSD and other substances that were undergoing research. So there's a wonderful book by Michael Palin, and many of your listeners will either have read it or know about it. But How to Change Your Mind is the name of the book. And it does an incredible job of laying out all of that history and the path that we have kind of taken up to this point. And there's also, maybe it's Netflix. I apologize if I'd said the streaming platform wrong, but there's a 4-part series that covers the book, but the book is way better. Anyway, it lays out that fascinating history around psychedelics and kind of where it brings us to where we are today. So during that time, there has very limited research for a long period of time, and then research began to happen with MDMA in the 80s through MAPS, which is the Multidisciplinary Association of Psychedelic Research, very prominent research institution around MDMA. And they began to do research around MDMA and mental health, like PTSD and depression and alcoholism or addiction. And so a lot of it kind of came forward through that. And, my kind of go-to answer for your question was like, there were probably some discoveries along the way that provided indications for other potential benefits. So today we're seeing a lot of positive outcomes, particularly for treatment-resistant depression. And there's a particular criteria that provides us with a diagnosis for treatment-resistant depression. But in general, it's when you have tried everything under the sun and nothing has helped. And psychedelics, in particular ketamine and psilocybin, are really coming forward as really efficacious for treatment-resistant depression. They're seeing significant benefits with PTSD, and particularly for veterans who have really struggled with PTSD. Huge benefits for them. Lots of positive outcomes in addiction. Lots of positive outcomes in obsessive compulsive disorder, and an area that just is fascinating to me, end of life and palliative care.
I was just about to ask, if that was also a research avenue that was still being pursued, because
absolutely,
I think, that's amazing. One of my favorite, I won't call him a psychonaut because he did not come out that way, but he was Richard Alpert, who worked with, I can't, now I'm blanking on his name. Anyways, they were the partners that, initially brought the research to Harvard, and then they both got kicked out.
Yeah.
But
Yeah.
he, at the end of his life, he, not so much working with psychedelics, but just in general, he had this tremendous outpour of just wisdom and experience to give around end of life treatment, and just being with people in those moments. And so I think that was kind of when I learned about that. It's kind of around the time I also discovered, like, oh, they're actually approaching this with psychedelics as well. And I think, correct me if I'm wrong, but also some terminal cancer patients. I mean, that's still end of life, but it's more like helping you accept some things if that's how you choose. Yeah. It's incredible.
Yeah, there's quite a bit of research. One of our lectures in my program just last week, and I can give you all the information for people to access this research, but it was a gentleman who had done a lot of research with terminal cancer patients, and just phenomenal outcomes for folks dealing with the existential threat that they're under, and the depression and the isolation and the, and then just having a positive dying experience after having undergone, psilocybin treatment. I mean, that's amazing. I mean, if you think about how we treat, death in our culture today, it's not a pleasant experience for many, many, many people, and to have a positive dying death would be phenomenal for so many people.